Hello, everyone. Back to our conversations with various people and experts on COVID. Today, I have with us Dr. Varsha Narayanan, consultant in family medicine and holistic health. Varsha is also the founder of Dr. Varsha's Health Solutions, a global online interactive health platform. Thank you so much, Dr. Varsha, for joining us this evening. Lovely to
Thank you.
have
My
you.
pleasure.
So, we met in India on the 31st of Jan, and little did we know that 2 months from now, exactly to the day that we're having this conversation, that the world is completely changed. Um, yeah,
Yes,
so
yes, I totally understand that, and it's a very difficult situation for most of us. And I think there are a lot of issues worldwide and so much difference in different countries to tackle this. But still, there is a global platform now where we are fighting this difficult situation.
yeah, I just wanted to start. I'm going to ask you today questions which are not very much spoken about, which I think are on all people's head, but there's not much of that spoken. Most of the time, it's spoken about wash your hands, don't touch your face, keep the distance. So we've got all of that, a lot of that going around. So I want to stick to questions which are not so frequently asked so that it gives further insights into areas which are not spoken that much about. So the first thing I wanted to ask was, there are so many viruses in the world. And it's been around for a long time. So many new viruses come every year. Is it some kind of a scheme that make COVID so popular or so demonized that we're all so much in fear and panic? Or is there something real behind this that we all should know that there is something different here?
Right. I think this is a important question because there is a lot of not only fear, but I would use the word panic that has come around COVID. So I think the few reasons for this are number one, that this is a virus which has never been encountered before. So, in fact, coronavirus is not a new virus. There are many strains of the coronavirus which cause common cold, and they are prevalent all over the world, and they infect commonly every year.
Mm.
But this is a new strain of coronavirus, and just like the SARS was in 2002, so this is again a new strain which has come about, which has never been encountered before. So anything new is bound to be, the fear of the unknown. Secondly, this is also a virus which tends to have a rapid spread. So we have something called the RO factor, which is about 2.3 or a little more for this virus. So each person can quickly infect 2 to 3 patients, unlike certain other similar flu type of viruses which are in an RO range of 1, like the influenza virus. So this is another problem, that the spread is rather rapid. And thirdly, the modes of spread are also, something which are very easy to catch, like it's air droplets, which are in air for about 1 to 2 meters. So it's so common to be in this kind of a distance in trains or public transport or on roads, in institutions, public places. So it's very easy to catch it.
Yeah.
Also, it stays on surfaces for, almost 12 to 24 hours. So again, it's again easy, for people to get it and touch their faces. It comes. So that's another reason why the spread has been so rapid. And I think another important reason is also the mortality. For common cold or influenza, we still have way under 1% mortality, but this is showing a slightly higher mortality, about 2% overall. But the elderly and people with pre-existing medical illnesses are showing a fairly high rate, even up to 10 to 15%. So probably these are the reasons that there is a lot of fear around it. And of course, we don't have any treatment. Nothing is specific as of now. So there are neither specific drugs for it, nor is there a specific vaccine available for it. So I think putting all this together is probably the reason that people are very fearful. They don't know what it could entitle. It could, be serious. It could cause a lung fibrosis. It could lead to a pneumonia, which could, ultimately put them on a vent. So all these things are causing a lot of fear.
That brings me perfectly into the next question, which people are asking, that in a time where things have gotten so much faster, and we talk about disruption and development cycles, why is it taking so long to get a drug therapy out? Is what is on people's head. I'm just asking what people, the conversations which are going on, perhaps outside the, maybe these are all very stupid questions, but this is what is mostly discussed outside, right? Why is it taking so long? It's already 3 months.
I think this is a very important question, not stupid at all. I get, I keep getting this asked all the time because I have engaged in a lot of pharmaceutical research also. So, when we come to viruses, if you notice all the viral diseases, whether we talk about an influenza or we talk about hepatitis A, or maybe we're talking about HIV and, other viral diseases like maybe even a dengue or a chikungunya, specific drugs have taken time to come. And also the innate problem with viruses are that they integrate their genetic material with the host genetic material, which is the human in this case. And therefore to eradicate a virus would mean killing the entire cell, and that could make antiviral drugs far more toxic than the regular antibiotics that you have for various bacteria. And if I take the example of influenza, influenza is old. I mean, we've had this disease for, more than 100 years. And we got a antiviral for influenza, I think pretty late in the 90s, when we actually got oseltamivir. And this virus, when it mutated very rapidly, we got an antigenic shift when we got the H1N1 epidemic in 2009.
Yeah.
We were still ready with oseltamivir. We had that drug. We still had anti-influenza drugs. So we were somewhat able to contain that. And secondly, we were already giving a flu vaccine. So this was basically a new strain which needed to be added to the vaccine. So we could get the vaccine fairly fast in 6 months before the next flu season. Now, the issue that is happening in this virus is it's entirely new. And we don't have any past vaccine or drug therapy for coronavirus. And so what we are doing is we are trying to do with existing therapies. And the good part about existing therapies is some of them are showing effectiveness, but we don't have the time to establish it in randomized, robust clinical trials. So what we are really looking at is drugs which are showing fair amount of effectiveness in certain groups in China, or if some of them have shown in the US, in Japan. And we are trying to use these antiviral drugs. Some of them are anti-influenza. We have one which is an anti-Ebola drug. We have one, which is again anti-flu. There are two, three, in fact, which are anti-flu. So we are trying to use these drugs so that we don't have to wait long term for regulatory approval. These are already approved drugs, so they can be brought in fast onto the scene. We are even looking at anti-malarials right now. Again, there is a bit of, some studies have shown some kind of effectiveness, some have failed to show that effectiveness. So we are still, having a lot of armamentarium, but still nothing specific. And about the vaccine, I think the main point here is that the virus genetic coding has just been sequenced in early January. And I think China gave the sequence to the world, and companies have started developing the vaccine. And this vaccine has already entered a clinical trial in the US, and another global clinical trial is likely to start by September. And by early next year, 2021, we are expecting the vaccine. And believe me, that is a very, very fast tracking for any vaccine. So I
Okay.
think I'd like to be positive here, the way we are, fast tracking the vaccine, and hopefully by next flu season, I don't want to say we will have coronavirus next year, but at least we should be prepared with an armamentarium which is, effective by next year.
So if I just bring you back to the drug therapy, which possibly I'm assuming will precede the vaccine coming into play,
Yeah.
because they're already in trial and lots of things are going on. If I just want to ask, if you want to play this forward, how many months will it be before we kind of establish that this is likely to be the case? Then I assume that there'll be a lot more of that particular drug which will need to get produced and distributed across. How will that kind of play out?
I think that will be quite soon because already some of the drugs are in use. So, from an Indian perspective, I can say that, anti-malarial drugs like hydroxychloroquine have been brought into therapy. They have even been brought into, preventing a full-blown case in patients who are high risk or in direct contact with COVID cases, especially
Wow.
the healthcare workers. So that
Wow.
has actually been already put in use. Also, some anti-HIV drugs like ritonavir, lopinavir, we are using already. They were used even in China, and favipiravir mind you, has been used in Japan. It's been used in China. Remdesivir is being used in US. So I think a lot of drugs are already in use, and companies are fast tracking, production in countries where these drugs are not available. Like remdesivir is not available in India right now, so it is being fast tracked. Favipiravir is being fast tracked. Then bulaxavir, another drug, is being fast tracked. So there are going to be drugs, but the only thing is that we can't still say that this was a specific drug
Yeah.
developed for
Yeah.
COVID. These
Got
are
it.
other drugs approved in the past for other conditions like influenza or HIV or malaria, and they are proving to have some kind of effectiveness in these conditions also, especially to prevent very severe lung fibrosis. So as far as a specific drug goes for COVID, I think there is absolutely nothing on the horizon right now, and we will have to wait for time to come up with that.
So do you think that we will use these other drugs first, then possibly you'll get a vaccine, and only then they'll continue to develop a drug for COVID? Would that kind of be the sequence?
Absolutely.
Yeah.
Yes, absolutely. In fact, most mild cases are not being treated with drugs at all. They are being given therapy with, symptomatic therapy, and they are recovering quite well. So the drugs are being used to fight high-risk cases or those with evidence of pneumonia, and, in cases where the infection is proving to be severe. So I don't think the drug therapy is going to be mass use in terms of both requirement or approval. But
Mm.
yes, the drugs will come into play when there are, high risk and severe cases. And then, of course, the vaccine should be the next one to come in early next year.
So the reason I'm asking these questions associated with drugs, particularly and therapy, is, today it seems to be that we keep talking of flattening the curve so that we don't exceed the capacity of the ventilators and intensive care capacities that exist in hospitals. So in which case, the question which repeatedly the public have in mind is, how long do we stay at home? How long do we have these controls in place? How sustainable is this? So with the drugs coming out, would we be able to slowly start opening up some of this, or still the jury is out on that?
So I think this is going to be an individual country call depending on how equipped they are medically. Because, countries like ours, I mean, if we open up too soon, social distancing in itself is so difficult in a country
Sure.
like ours where, so many people live with common loos, they're filling water from common pumps, and, their balconies are common. So in such situations, it's very difficult for us to loosen up because it could go totally, out of control. And
Mhm.
so I think it's an individual country call, looking at the way the cases are multiplying. And I think once the case, you have a 14-day period with no new cases, that is ideally supposed to be the time that you open up a lockdown. So I know that sounds
Wow.
immensely optimistic at this stage, but
Yeah.
China is on that path. So
Yeah.
considering how severely they were impacted, so I think there would be that time coming in, but at different stages in different countries. And taking that kind of a call will have to be the individual governments, depending on their health facilities. And I do think that a certain amount of cases are definitely reduced by staying at home. I know it's quite a miserable thing to do day after day, but if we actually look at it, I think you're doing a great job. You're propagating indoor exercises with yoga and breathing. And so I think this may be a good thing, that people take up more of these wonderful ways
That's
of
true.
life. There may be
That's
a
true.
long-term change in attitude, change of life and lifestyle. So I think we have to be positive here and look for some good to come out of it also. Everything has some hidden good in it. And I do think that this should open up with a gradual fall in cases if we are able to sustain ourselves, with a grit that we have to comply with what the governments are telling us to do.
Yeah, I think that's important because my biggest fear is that people don't see the number of cases going down, especially in developing countries and emerging markets where you have, as you said, a lot of people who are naturally not socially distanced, and and they just at some point of time just give up because also a question of livelihood, and then they just come out onto the streets, and it just makes things worse.
Yes.
Hopefully, fingers crossed, we're able to get things to be in more in control before people tire of being by themselves or locked up. Yeah.
Yes,
So
I think it's a lot of mental health at play also here, along with simply physical, protection. And a lot of it has to come, as a family. I think, especially children, elderly. In India, we have a lot of joint families, and also on the other hand, have a lot of elderly who stay alone.
that's
So
true.
a lot of, systems in place have to come from the societies where they stay, the neighbors, they all have to come together in this. I don't mean physically together, that's an absolute no-no at this stage, but certainly, in terms of a system establishing
Yeah,
that they are trying to protect them, we don't cause them any other health problem. That is
that's
also
right.
very important to,
Yeah,
take care of the rest of your health right now. That's
yeah,
really imperative. Yeah.
that's right. Yeah, that's very true because how to strike the right balance and how to make sure that those who need protection get the protection, but at the same time, you know we're able to get this under control, right? So yeah, so I just wanted to I think you kind of answered that question because some countries like China, South Korea, Taiwan, and even here where I live in Singapore, seem to have a handle on operating this more surgically rather than what I call a blunt instrument like a lockdown. Um,
Yes.
uh, and whereas others are still at the, is it a question of the stage in which these countries are, which means that they first start with the lockdown and then they will progressively be able to loosen up with controls? Is that the, is that the, is it the stage at which they are in, or is that something else?
So I think from what we have seen globally, studying the way the disease has progressed in various countries, I think an early lockdown is beneficial. So before we hit what is called a community spread, which can be devastating in a country like India. So before that third stage is reached, I think the lockdown can help to at least prevent this kind of a mass forest fire kind of a
Mm,
spreading
mm,
happening.
mm,
So
mm.
I think certain countries did probably wake up a little late, and you can't blame that because the virus spread to different countries at different times. So I
Yeah,
think India was one country where we got it certainly later than other European countries did or the USA did. So I think we were vigilant and we were able to be alert and seal things much before it went into a community spread state. So I think I certainly credit the government for that. And this lockdown has certainly is going to have its economical impact. There is no denying that. But at this stage, the way our country's pattern, disease patterns have been in the past, and the way people live, we have to play on the stricter side. There is no question about that.
Yeah.
So I always say, if you ask people to restrict, they will reduce. And so you have to play on the restricting side for that to happen.
That's right.
So I think stage 2 is the time that one must proceed with a lockdown, and we have to really curtail it from getting into stage 3, because highly populated countries can go totally out of control in stage 3.
That's true. That's true. I get that. I just want to move to a slightly different kind of area. We've spoken a lot so far about the drug therapy, and then we progressed about understanding about what that cycle would look like. And also we spoke about how the communities and public health issues and the policy issues associated with this. You very rightly touched upon the point which I keep worrying about, that there is a health issue. I call it a health tsunami. There's an upcoming economic tsunami as a result of whatever actions we're taking. And the third one in my mind, always keep thinking, is about the psychological and social tsunami. So
True.
are people thinking ahead? And because I know there are a lot of NGOs in this space, and there are a lot of capacity. As much as we're thinking of ventilators and beds, maybe we need to get a lot of counselors and therapists also ready for the upcoming surge in this, right?
Yes, yes. In fact, we do have a lot of helplines in terms of mental health and counseling also now, which are being set up for it. And a lot of counselors, even corporates, are now trying to get counselors on board, especially for their employees. So I think that move is happening. Another thing that I am very positive in this matter is the family.
Mm,
Because the way lives have been so far, I think we have all been running on a fast track and in the rat race.
yeah,
And probably this has been like, nature's way of giving us some time to sit back and really be with the family. And it is well known that when we talk about mental health, or even things like, a feel good factor, or even immunity, spending time with the family is certainly something that is has positive effects. So where we are going to have the negative effects of economic loss, or even the inability to do the things you love outdoor, I
yeah,
do want to say that that may, to some extent get neutralized by the time you spend with your family. You
yeah.
will catch up on sleep, which will improve your immunity. You might
That's
eat
true.
much better, take your meals in a relaxed manner, indulge
Yeah,
in
yeah,
hobbies which you have been dying to do for so long, catch up
yeah.
on books, music. So I do want to play it positive here, that, these things will probably give an upliftment to a lot of people who have been running it fast so far.
Fantastic. And I want to really end on a positive note, like, and what you kind of was speaking about, which is this is a time possibly for us to consider building our own personal immunity and that of our family. What suggestions would you give to us as to whether it's about diet or exercise or supplements or anything that, because especially this is up completely up your field, right? It's
Yes.
about, so I wanted to just pick your insights on this.
Yes, I think immunity is something which has to become a way of life to build. It's not something you build when a disease comes along, or an epidemic is happening. So this should be a time when we actually consciously improve the four major aspects of our life. And I think diet, your exercise, where I would put, your physical activity. Thirdly, sleep. I mean, very underestimated, but sleep has a very important role to play in immunity. And the fourth is the stress management, which is, I think, one of the worst for immunity is stress.
Mm,
And fifth is,
mm,
of course, your personal hygiene and what the cleanliness that you maintain. So if
mm,
I talk about diet, the on the run diets and the refined items, the fast foods, the highly fried, high sugar content meals, all these packaged foods that we are so used to in our daily run, that has to be put aside, and we've got to get into good vegetables, green vegetables, include a lot of fruits in our diet, nuts in our diet, whole grains, yogurt, and even spices like turmeric and tulsi, which we call basil, and things like honey. There is garlic, ginger. So whole lot of rich foods which are available to us, which needs to be included. And apart from that, a lot of water. This is something that we even forget, but even from a COVID perspective, this is a good thing that we keep drinking a lot of water and remain hydrated. So this can certainly improve our immunity. A few lifestyle changes I would certainly suggest: to give up smoking, if at least reduce it. As I say, restrict is what makes people reduce. And go a little low on alcohol and caffeine if possible. And also physical exercise. Certainly, I know some people are really used to walking outdoors and they don't know anything apart from gymming or taking an outdoor walk. But this is the time to probably explore things like yoga, which you I'm sure are doing a wonderful job. I'm really really in appreciation of that. And also other things like breathing techniques, simple breathing
yeah,
techniques,
yeah,
stretches that you can do at home.
yeah.
And also, even if you have a treadmill and cycle or something, you're lucky. I mean, but many don't have that. But something like, just spend less time sitting, do a lot of housework. Even that is physical activity,
That's
that you
true.
engage in housework, or, just dance with your children, or,
That's right.
engage in
That's
those
right.
kind of things. So I think that is so stress busting. And stress is, I think, at least to some extent can reduce if you are catching up on good amount of sleep. This is an interrelated thing. So more stress, less sleep, less sleep, more stress. So that's something, that vicious cycle, this is the right time to break.
Break
So
that.
that can
Yeah.
really really contribute to immunity. And just one thing I'd like to add here, that ventilate your houses well.
Ah,
Sometimes there is this fear that we should keep our windows closed. I mean, COVID is not going to come rushing through your window. It's not just going to come with a draft of air. So ventilating houses is very important for the system. And let sunlight come in. We need our vitamin D for our immunity. So let's have that sunlight and air coming in through our windows or balconies. So I think all this can certainly take care of our immunity, and it should become a way of life.
fantastic. Thank you so much. I'm just going to summarize that. So, diet, you said eat fresh, eat green, eat your fruits and nuts, get some honey, turmeric, ginger, and garlic into your diet. Um, kind of that, and your hydration.
Yes.
I think that's what I got. Reduce your, if you will, your stimulants, whether it's nicotine, caffeine, or alcohol, and step up a little bit on the exercise. Even though you're going to be at home, you can do stuff which and I did something this yesterday for a big corporate team, which was about, I said, what can you exercise in if you just had a space of 3 feet by 3 feet? So
Wow.
it is still possible to do that, right? And I was speaking with someone in the US, and she said she works with prisoners, and she was saying all her prisoners are now working out 2 3 hours every day because they're stressed.
Wow.
So if a
Amazing.
prisoner can do it in their cell, all of us can.
Absolutely.
Yeah.
Absolutely.
And if you just did burpees, you're good. That's a good exercise to do your push-ups, you do your burpees. They are very active and things that you can do. Breath exercises, of course, to keep your lungs going. For stress, there's something interesting which I started off about 15 days ago. I call it HOHAM, heal our heart and mind. And it's one positive activity a day, which I think you will have seen some of that out there in the
Yes,
social
very
media.
much. Very much, and I'm always, going through that and sharing it with people. It's a beautiful initiative, and we should have more such initiatives. And to add there, music is one of the biggest stress busters since I'm so into it myself. So I thoroughly recommend it for everyone.
That's
Yeah.
right. You make music, you play music, so it's fantastic, right? So you must be getting the best of that sitting at home. Um,
Yes, very much. With children also.
Fantastic. So that's on immunity. I think it's a fascinating conversation. I just want to go back to the start. And you were saying, first of all, you said COVID is creating this fear or even panic because it's the fear of the unknown, if you will. It's something new, even for the healthcare community, for the medical, for the doctors, and for people in the research area. So it's still early days, but I would say maybe somewhere 3-4 months into it. But because of so many unknown factors, there is people being more cautious about how to deal with this whole thing. Second, we spoke about the drugs and the therapy associated with that. And you were saying that there is a lot of other drug therapies which are being tried. Safety has been cleared, but efficiency not yet known. And maybe specificity yet to be known for sure.
Yes,
And
yes.
that will take some time to play out, but there is a scaling up of all of this. And you're saying most of the people will heal without even the need for drugs, but the drugs are required to give comfort to those who have conditions or the older people who are relatively
Sure,
weaker,
severe cases.
severe cases. Vaccine, you were mentioning that it's like super fast tracked, can't be faster than this, but should be out by something like Q1 of 2021, um,
Yes,
and like somewhere around the same time next year, or slightly earlier than that.
yes.
So, and then we spoke about the how it is important for us to keep this restriction in place so that we get ahead of the curve, and at the same time be mindful of things like mental health, so that you're prepared to support if there is a knock-on effect of that coming into play, and you are quite confident that that's in play and will be taken care of. I think the most fascinating part of the conversation was about personal immunity. If I got it right, it was diet, exercise, sleep, stress, and of course hygiene. The wash hands, wash your feet, make sure that you are careful about personal hygiene. Yeah. Is there anything else that you would like to say before we wrap up this conversation?
So I would just like to say this that, firstly, fear also reduces immunity. So do not fear. I mean, fear doesn't bring us anywhere. So what we should do is follow what our governments are saying, and also not fear. Probably use this time as a time which may not come again, and we can actually make the most of it. So let's have a positive attitude to this, because this is certainly going to help us both in mental health and in immunity. And second thing is, let us not forward too much of unverified information, because that tends to spread a little bit of panic. And I have seen a lot of WhatsApps which come in, which are not only untrue, they are unauthenticated, and they are very scary, and they kind of spread a kind a kind of fear which we don't want to do. So spread what is medically authenticated, what the actual government is putting forward, or a registered body like the WHO or the
Yeah.
CDC, or authenticated medical information. You can certainly share that. That's a good thing, but let us not just forward everything that comes to us. That's just a request I want to put through here, being a doctor. Otherwise, I think we are going to fight this, and the world has seen worse. I will not deny that. So we are going to get this through as well.
Thank you so much for giving us that hope and confidence, because that makes a big difference to staying positive in these times, especially when we are when we are at home and wondering what's going to happen next, right? Thank you so
Yes.
much for your time, Dr. Varsha. I hope to have you back on our conversations. sometime with a little bit more positive news, maybe a few weeks from now. Yeah.
I hope so too. I sincerely look forward to that.
Thank you so much.
Yes,
Namaste.
my pleasure. Yeah, namaste.
Thank you.